I saw a patient, and this patient, unfortunately, when he was born, his testicles had not descended into the scrotum. In fact, they were still within the abdomen. And at the time people were noticing this was when it was already puberty for this child. People were wondering that, oh, why is this child is already 14? Why is he not developing sexual characteristics? Why are there no pubic hairs? Why is his penis not enlarging? Why the testicles not enlarging? And things like that. And by the time they came, guys, you will not believe that the testicles in the abdomen had already vanished. He did it. Hi everyone, welcome back to my channel. It's Dr. Judith Ebengho here. I hope that you're doing well. First, I want to say thank you to everyone who have subscribed to this channel, who like my videos, who share the videos. If you have not yet subscribed, what are you waiting for? Please click the subscribe button and turn on post notification, because this is where we share all the juicy health content and you do not want to miss a thing. So today I'm bringing you a series on infertility. I'll start off today by introducing the topic, and then we'll discuss further in subsequent videos. First, why is this topic important? We are Africans. Yeah, this is me assuming that a lot of people who watch my videos are Africans, and it's really important to us to have children. Culturally, it has just been ingrained in us that, once you get married, then the next thing is to have children. So culturally, as a people, having children is really important to us. That is why this topic on infertility is an important one to talk about. So first, what is infertility? Infertility is the inability of a couple to achieve conception after 1 year of regular ejaculatory peno-vaginal sexual intercourse. So I'm going to break that down. First, what is regular sexual intercourse? Regular sexual intercourse has to be at least 3 to 4 times in a week. So you cannot, as a couple, you cannot say that you're infertile if you're having sex only when you ovulate. I say this because I've seen a couple of patients in clinic that will come and say, oh, they time their ovulation and that's the only time that they have sex. Well, that is a good method, but that is not the best, because as women, a lot of things affect our cycle. First, if you're stressed, your ovulation may not be at the same time it used to be, like when you calculate it. And also, if you've lost a lot of weight, your ovulation may change. So if you're targeting sex at only the time when you ovulate, then you may see why it may be difficult for such a couple to achieve conception. And so you have to have sex for at least 3 to 4 times a week before you can say, we are suffering from infertility as a couple. Then the next thing that I talked about, ejaculatory. Does your partner ejaculate? And the other term in that definition, peno-vaginal, does your husband ejaculate into your vagina? So there are different sexual positions and whatnot that people try, but when it comes to infertility, the sexual intercourse has to be regular, at least 3 to 4 times a week. It has to be ejaculatory and peno-vaginal. That means the penis inside the vagina. Until you have satisfied this criteria for a year before you can say, oh, we are suffering from infertility as a couple. Also, it is worthy to note that for a woman who is about 35 years, then we do not have to wait till a year. We reduce that definition to 6 months. There are 2 different types of infertility. There's the primary infertility and then there's the secondary infertility. Primary infertility is when a couple has never been able to achieve conception. That's, they've never gotten pregnant before. Then you say, oh, there's primary infertility. But secondary infertility is for couples who have gotten pregnant before, regardless of the outcome of that pregnancy. If they've gotten pregnant before and then they've not been able to get pregnant following that, then you can say, oh, this couple is suffering from secondary infertility. At this point, it's worthy to note that the different causes of infertility, it could either be due to the man, or it could be due to the woman, or it could be due to a combination of both factors. This is why the evaluation for infertility has to be done as a couple. We have to evaluate ourselves and then see what can be done going forward. There's not just one person to blame when infertility is an issue. Like I mentioned before, there are different causes of infertility. There are causes for men and then for women also. What are the causes of infertility for women? The list is endless, guys. There are some general factors like malnutrition, things like undernutrition, that's not getting enough nutrition, or overnutrition, like taking too much, things that may cause some obesity or someone being overweight. That can affect the hormones in a woman and then predispose to infertility. Things like stress, things like some mental health issues like depression, anxiety. The list is endless, guys. There are also some endocrine factors that may cause infertility, things like thyroid disorders. So if a woman has hyperthyroidism or hypothyroidism, all of this has a way of affecting the menstrual cycle, which would now further cause infertility. Then things like adrenal hypoplasia or hyperplasia, things like pituitary failure. So for example, if a woman bleeds too much during delivery and then goes on to suffer from Sheehan syndrome, that may also affect our ability to get pregnant subsequently. Also, things like polycystic ovarian syndrome. This is an hormonal condition that can also cause infertility. There are also some things that may happen developmentally, some things like that may affect the ovaries that cause there are also some developmental issues that may cause infertility, so some things that affect the development of the uterus. So some conditions may just the uterus may actually be absent or may not develop fully, and in such women it will be a bit difficult for them to get pregnant. And also things that cause gonadal dysgenesis, some conditions like Turner syndrome. Now is an important time to share a story with you guys. One day in clinic, there was this woman who came in and she had features suggestive of Turner syndrome. You may want to look that up. They have some physical features that may just tell you that, oh, this person may be someone with Turner syndrome. Sometimes they have web neck, they have broad shoulders, there's a way their hands are positioned and all of that. So this woman had web neck. That was the first time I had seen this outside of a textbook. And guess what, guys? She came in with complaints of inability to achieve conception. And she was already like in her 50s and everything, and just by merely looking at her, we could tell a bit as to why she experienced a delay with achieving conception and why it may be difficult for her to actually get pregnant. So all of these things, guys, just even the genetic makeup of someone can actually predispose to infertility. And the other things that affect the reproductive organs of a woman, things like pelvic inflammatory disease, things like uterine fibroid, things like endometriosis, which we're going to talk about in this series, guys. So you want to subscribe, you want to turn on post notification, because this series is going to be a very, very big one. Things like even tuberculosis, things like sexually transmitted infection, guys. All of these can cause tubal. Some of these things can cause tubal blockage. Different things they can cause. So I'm going to cover each of them like individually in subsequent videos. So these are some of the things that may cause infertility for a woman. For a man, what are some of the things that may cause infertility? There are general factors that can predispose to infertility. If a man is suffering from mental health issues like depression, anxiety, things like that can predispose to infertility. If there's chronic stress, it would be a bit difficult to achieve conception. Then some endocrine factors, some of the things which I mentioned for women. If a man is suffering from thyroid disorders like hyperthyroidism, hypothyroidism, if there are issues with the adrenal glands and things like that. Also things like varicocele. This is when the veins around the testes are a bit engorged. Things like premature ejaculation, things like retrograde ejaculation. This is when the semen, instead of coming out through the penis, goes into the urinary bladder. Things like that. All of this can affect a couple's ability to achieve conception. There are also some developmental issues in men that may predisposed to infertility. An example is cryptorchidism, which is also known as undescended testes. Some children are born without their testicles fully descending into the scrotum. Embryologically, the testicles originate from the abdomen. It is now during development that they begin to descend and then get into the scrotum. But for some children, this doesn't happen fully before they are born, especially in children who are born preterm. So it's always good to examine and then look out for the testicles, or have they fully descended and all of that, because the intervention for this is time bound. I have a story for you guys. In clinic one day, I saw a patient, and this patient, unfortunately, when he was born, his testicles had not descended into the scrotum. In fact, they were still within the abdomen. And at the time people were noticing this was when it was already puberty for this child. People were wondering that, oh, why is this child is already 14? Why is he not developing sexual characteristics? Why are there no pubic hairs? Why is his penis not enlarging? Why the testicles not enlarging? And things like that. And by the time they came, guys, you will not believe that the testicles in the abdomen had already vanished. He did an abdominal CT scan and we could not find the testicles at all. This is because if the testes do not fully descend into the scrotum, with time the body begins to absorb it, and when you look, you may not even find the testicles at all. So for this child now, even if he does some hormonal therapy that helps him maybe develop into a man and everything, he doesn't have any testicles. It's going to be difficult. In fact, it is practically impossible for this child, or for this man later, to impregnate his wife. So if you have a baby boy, ensure that the testicles are in the scrotum, and if they are not, please seek care early, because it is time bound, so that the testicles do not get destroyed by heat and everything, so it is repaired and then put in the right place. Other things that may predispose to infertility in men include sexually transmitted infections, things like mumps and all of that. We cannot exhaust the list of causes of infertility. It's almost impossible to do that, but I just had to give a few things that may predispose to infertility. And if you're watching this video and you think, okay, I think I have some of the things that have been mentioned in the video, I think that this may be the cause of the infertility that I may be experiencing, guys, please do not take laws into your own hands. See a specialist, speak with a doctor. Most times couples who may experience infertility over time, with some intervention, are able to achieve conception. So you definitely want to see a specialist. Do not start googling your symptoms. That is very wrong. With all of this, we've come to the end of this video. Please do not forget to like, share, subscribe, leave a comment. If there are specific topics that I have mentioned as causes of infertility here that you want me to talk about in this series, please let me know. Leave a comment for me. There are people that need this video, guys. Do not hoard this information. Alright guys, remember that this is just the first video in this series. More videos to come your way subsequently. Till I come your way next time, I remain Dr. Judith Ebengho. Bye.